I'm Nancy Sweitzer. I'm the director of the Heart Failure Program, which is a component of the Advanced Heart Disease Program. Advanced heart disease is a term we use to describe heart disease that started with any one of many, many different kinds of heart problems that has progressed despite treatment to a fairly advanced stage. When a patient's first referred to the Heart Failure Program or the Advanced Heart Disease Program, I think the experience is very different than the experience when you're referred to other doctors and other specialists even. Generally, one of our nurses will call the patient prior to the visit to find out a little bit about them, how things are going, how ill they are, how quickly we need to get them in. And then the day you come to your clinic appointment, you'll be seen by multiple people in the clinic, not just the doctor, but you will see pharmacists, nurses, sometimes you'll see nutritionists or social workers, depending on whether we identify issues that we think we can help you with that may impact how you're doing with your disease. My goal when I see a new patient is to determine what are the barriers to optimal health in that patient. Sometimes the barriers are they're not taking the right pills in the right combinations, and that's my job. I'm good at rearranging the pills and getting the combination right. But sometimes the problem is that their diet is not optimal for keeping fluid out of their body. They're eating too much salt, for example, or drinking too much fluid. So we get our nutritionists and our nurses in and educate about diet. Sometimes you can't afford your medications. You're prescribed the right pills, but you're not able to take them because you can't afford them. So we'll work with the social work team and the pharmaceutical companies and whoever we need to try and get you on a combination of medications that you can afford that will help your heart improve as much as it's possible for it to improve. We have staff available 24/7. Patients are all given contact information and can reach us anytime they want. Many patients find this a very refreshing change in this era of it being very hard to contact anyone who is going to pay attention to you when you're ill. One of the tools that we use with many of our patients is a home monitoring system. The patients will get up in the morning and weigh themselves on the scale and then either log on to a website or call an 800 number on the phone and then put in the weight that they got that day, answer a few yes or no questions, about 6 yes or no questions, and then all of that data is put up on a website and our nurses can access that data every day. So if you're starting to put on fluid and your weight is creeping up or you're starting to feel more short of breath and you're one of those people who doesn't like to call and bother the doctors or the nurses at the hospital, we'll know that's happening because we'll look at the website and we'll see that you're more short of breath, you gained 5 pounds, and we'll call you to get things back on track. The physicians in the Advanced Heart Disease Program do travel around the state of Wisconsin and into northern Illinois to work with some of the cardiologists around the state who are in larger cardiology group practices. We use the team approach here where your primary cardiologist may be near your hometown and you might see that cardiologist every other month or every 3 months. But the heart failure cardiologist from the UW might be up in that town once a month as well, and we're available to see you in partnership with your cardiologist in order to optimize the care that you're getting and work with your doctors to make sure that we're doing everything we can to keep the disease as tightly managed as possible.